Hi all, this is Dr. Ragini, fertility consultant from Ferty9, Hyderabad. Now I'd like to tell you about a very interesting topic, that is uterine anomalies. What are uterine anomalies and how do they delay in the fertility outcome? Okay. Uterus is a small bag, it's a muscular bag where the baby grows for 9 months and becomes it gets enlarged as the baby grows. So, it is fibromuscular, means not just it's small, it grows up when the baby becomes big. So, basically what is more important is how is the cavity and how is the uterus. Enough space should be given to for the baby to grow. So, with the help of scans we could make out how is the cavity, how is the volume of the cavity, and is there any other abnormalities in the cavity. So, what are the uterine anomalies mostly we encounter in females? See, uterine anomalies are mostly congenital, in the meaning they are born with those anomalies from birth. Okay. Uterine anomalies, there are different types. There is something called as unicornate uterus or a single uterus, or it's a bicornate uterus, or is a septate uterus. Okay. In that unicornate uterus, normally what happens is the two small uterine structures grow together independently and form a single cavity. Okay. But once during this development, both the uterus sometimes remain as two itself and they do not fuse to form one. In those cases we say that it is diadelphous, means two uterus. And sometimes during the development while fusing they form a single uterus, but sometimes some part of the uterus will not get absorbed and they remain as a septum. So, though it looks like one from outside, inside the cavity is split into two, because the septum which actually has to be absorbed is not absorbed. So, all these cases the cavity is distorted, the cavity is altered, there is a small cavity. In these cases there will be delay in conception. Why? Because though the embryo is formed, though the egg is released, the sperm has entered, the embryo is formed, once it travels into the cavity, when it gets implanted, means when it gets attached to the uterus, the space is not good or the blood supply to the embryo is delayed. In all these cases, in any of the anomalies cases, the uterine blood flow to the growing embryo is impaired. So, it causes most commonly abortions. Okay. First trimester abortions is seen when there is a septum. So, in these cases we will do a 3D to see what extent is the septum, and with the help of hysteroscopy we will try to remove the septum from below only. A small pen size camera is used to insert it from below, from the cervix into the uterine cavity, and when there is a septum which is in between is removed with the help of a hysteroscopic scissors or a resectoscope. With this, now the cavity is restored to its normal size. So, whenever the embryo is ready, it nicely attaches to the highly vascular uterine wall rather than the septum, which was usually otherwise if the septum is there. So, in all this, now the embryo is attached to the muscular wall, it grows well up till 9 months by giving a good nourishment to them. That is why in any of the anomaly cases, there will be most commonly complaining of bleeding in first, though they get pregnant, there will be first trimester and a mid trimester abortions encountered during this uterine anomalies. And also most importantly is, if there is any uterine anomaly, though they are resected or corrected, those patients it is better you go for uterine cerclage. Cerclage is something like, because of the anomaly or development is not very good, there is a weakness in the cervical opening. Sometimes it becomes weak. In those cases, once the pregnancy is confirmed and after 3rd month or 4th month, once the scanning and everything is done normal and we get the information of the fetus, then we get a stitch around the cervix so that it will hold it properly. These are all later later important precautions to be taken for the uterine anomalies. Okay, and these are the most common, and sometimes we see two uterus, each uterus has its own tube, its own ovary. So, wherever is the egg release, then that side will be the success of the conception. So, in those cases also we can manage in that way. Okay. Any of you facing such complaints of repeated first trimester abortions or repeated bleeding during pregnancy, you can come to us to get it all the thorough investigations to be done, and we will give the perfect management how to do it and give a pregnancy. Any queries regarding this, please do come to Ferty9 to get it. We have to do certain blood investigation along with the scan report, both combined together, we should call them as PCOS. So, will that PCOM picture